1. Epidural anesthesia. Nowadays, it is not possible to imagine a surgery without anesthesia. However, less than 200 years ago, patients suffered unspeakably when having a surgery. All that could be done was to give them an alcoholic beverage that would stun them and an object to chew on during the surgery. Without anesthetics, surgical techniques did not progress either because they had to be very fast, so as not to prolong the patient's suffering. Finally, in the middle of the 19th century, inhaled anesthetics appeared, such as ether or chloroform, which put you to sleep completely. But they affected critical organs like heart, liver, and kidneys, often causing death. So, doctors did not stop investigating, among other things, the possibility of numbing only what was necessary, that is, the region or the limb to have the surgery on. At the beginning of the 20th century, there were already quite a few published studies on the effects of different substances, including cocaine, injected at different levels of the spinal column, and in more or less deep areas of the spinal cord, but the results were not encouraging at all, because these different techniques worked sometimes and sometimes did not. This is when Fidel Pages makes his appearance, a Spanish doctor who worked as such in Morocco War and in the First World War, and who, thanks to his level of German and French language and his great interest in preventing others from suffering, was up to date on advances in anesthesia around the world. He was the creator of one of the most used techniques in surgery that turned out to be really effective, epidural anesthesia, consisting of the administration of an opium derivative by using a catheter instead of a needle at the level of second and third lumbar vertebrae. The anesthesia is introduced into the space that remains between the bone, the vertebra, and the outermost and fibrous layer of the meninges, which is the dura mater, and this is the reason why it is called epidural, because it rests on that layer. We can get an idea of what this stupendous medical professional was like by watching the Spanish A Tres Medias Tiempos de Guerra TV series about Rif War, in which the actor Fidel Calderón personifies Fidel Pages.